My name's Dr. Carrie Weyden. I'm a clinical haematologist and I work at the Peter MacCallum Cancer Centre in Melbourne, Australia. PTCL generally is a rare diagnosis. Our patients, obviously, when they come in with either a new diagnosis or a relapsed refractory diagnosis, are looking for resources to help guide them for some additional information about it, but to contextualize their journey, put it in the context of other people who may have walked that same path. And so in that context, a resource like HOPE-PTCL is actually quite key to our patients, learning how to adjust to the diagnosis of PTCL, but then to explore other opportunities for them in terms of treatment options, what we would regard as standard of care, and what future novel treatments might be available to them. Australia is a very big country, but one that's very sparsely populated. And so it's one of the big challenges that we face, particularly with our patients, is that they're quite geographically dispersed. Patients will often, with a new diagnosis of PTCL, be located in multiple different centres across Australia and may feel a certain keenness or aloneness in terms of how they deal with a very rare cancer diagnosis. Because of that, something like HOPE-PTCL may help to reassure those patients that they're not alone, but also to give them a sense of being part of a bigger community of patients who've gone through that same journey. The other important thing in an Australian context is giving the patients a sense of what their treatment opportunities might be, particularly with PTCL in general, and noting that it's something that we often explore novel therapies for. Standard treatment may be very different to the sorts of treatments that they might be familiar with in terms of other cancer diagnoses. So having something like HOPE-PTCL, where they can access that from the privacy of their own home, but really spend a bit of time looking at patient journeys and learning a bit more about PTCL in words that are easy for them to understand, I think will be quite key.